Feeling anxious, on edge, having trouble sleeping, eating, or concentrating? Maybe you have a big test coming up, or maybe you are undergoing some stress in your family life, like helping out a sick parent or sibling. Now imagine feeling that way all of the time. Even if you didn't have anything particularly to worry about, that's what anxiety is for millions of sufferers. Anxiety disorder are the most common mental illness in America. According to the Anxiety and Depression Association of America, 40 million Americans over the age of 18 are affected by anxiety. How many of you have ever thought you've had symptoms of anxiety? Even if it is just a mild case of anxiety, I feel like everyone has had some sort of anxiety in their life. There are many types of anxiety disorders, and today I'm going to talk about two of them. The first anxiety disorder that I want to talk about is called general anxiety disorder. For a person to be diagnosed with general anxiety disorder, they would have to have excessive anxiety and worry about several events or activities most days of the week for at least 6 months. Difficulty controlling your feelings of anxiety or worry that causes you significant distress or interferes with your daily life. Adults must have at least 3 of the following symptoms, and children must have 1 of the following symptoms to be diagnosed with general anxiety disorders: restlessness, fatigue, trouble concentrating, irritability, muscle tension, or even sleep problems. General anxiety disorder develops slowly. It usually starts developing during the teen years, and the symptoms usually change over time and get worse when the person is in what they feel to be a stressful situation. When your anxiety is at a mid-level, you can usually function socially and can deal with little things that make you have anxiety. But when you're having a high level of anxiety, it can be hard to even do simple daily activities. For example, some people have high anxiety when it comes to what everyone else would imagine as simple: driving. Some people cannot drive just to the grocery store down the street unless they have perfect weather conditions or any other preferences. Something like this can scream anxiety disorder, and doctors certain can use certain situations like these to help identify a person's problem. This can be identified by asking the affected person a series of questions to help understand the problem. Once diagnosed, treatment is usually psychotherapy, certain medications to help maintain the symptoms, or sometimes even both. Of course, at some point in everyone's lifetime, we experience some kind of anxiety or sometimes even depression. But to be diagnosed with an actual disorder is a serious issue that needs to be talked about more and addressed. Moving on to social anxiety disorder, which goes hand in hand with general anxiety, just in a little more detail. Social anxiety disorder is a high anxiety or fear of being judged, negatively evaluated, or rejected in a social situation. People with social anxiety disorder may worry about acting or appearing visibly anxious, or being seen as stupid, awkward, or boring. They often avoid social or performance situations, and when a situation cannot be avoided, they experience significant anxiety and distress. Many people with social anxiety disorder also have a lot of physical symptoms like rapid heart rate, nausea, sweating, and may have full-blown panic attacks when confronting a feared situation. Symptoms may be so bad that they disrupt daily life and can interfere significantly with daily routines, work performance, or social life, making it difficult to complete school, interview and get a job, and have friendships and romantic relationships. People with social anxiety disorders are also at more of a risk for developing major depressive disorder and alcohol use disorders. A couple of examples of this are going to public events with a lot of people in the same area, like concerts, gaming events, or marathons. Any public event with a lot of people in a small space can make someone with social anxiety have a panic attack. The specific anxiety disorder can play a huge part in people not living their daily life. This can go down This can go down to even going to the grocery store. Sometimes even just going to Walmart can be hectic and busy, and sometimes all of us might take for granted by someone who can do these things easily. All kinds of anxiety can be managed and treated effectively. Anxiety disorders are usually treated with psychotherapy, medication, or even both. Psychotherapy teaches the anxiety-filled person new positive ways of thinking, behaving, and reacting to different situations that normally make the person feel nervous or anxious. The two most popular forms of medications for anxiety are antidepressants and sedatives. Antidepressants affect the neurotransmitters in your brain, and the most popular antidepressant medication used for treating anxiety is Zoloft. Sedatives relieve short-term anxiety. A sedative is a drug that induces the nervous system to calm, which helps the person with anxiety. The most popular examples of these types of medications are Xanax and Valium. As someone who suffers from high anxiety on a daily basis, I hope giving numerous examples and my personal experience with anxiety helps you understand it better as a whole.